In this video, we will talk about the medications that poison the nerves and cause nerve pain. The famous Dr. Hippocrates says, first, do not harm the patient, and can a doctor harm the patient? Yes, this is possible by giving medications that hurt the nerves and cause nerve pain. Okay, how does this happen and what are these medications? This is what I will discuss with you in this video. Before we begin, I would like to remind you that this channel is for you. Subscribe and activate the notification bell so that you receive all new updates. I would like to point out an important matter. The purpose of the information contained in this video is to raise awareness among patients and those around them and educate them about the best scientific methods for treating pain. It is not intended for treatment. The patient must consult a doctor before making any adjustment to the treatment plan. Now we begin, with God's blessing. It is true that the purpose of medication is treatment in order to heal or at least improve symptoms, but most chemical medications have harmful side effects on the body, as you know, and unfortunately medical practice today depends on giving multiple prescriptions for medications. According to statistics from the U.S. Centers for Disease Control and Prevention, CDC, the vast majority, estimated at about 90%, of people aged 65 years or older take 5 or more medications. Can you believe that? The result is that they are exposed to the bad effects of these medications, with the possibility of them conflicting with each other. Some of the bad effects include causing nerve damage or worsening of nerve pain if it is present for another reason. Therefore, it was one of the most important pieces of advice from Hippocrates, and Hippocrates was called the father of medicine, and the reason for this name was that he was the first to begin teaching the science of medicine to the general public, and before him, medicine was limited to specific families, where the father doctor only taught his children and passed it down. He opened his door to teaching whoever he wanted, and for this reason he is known as the father of medicine. One of Hippocrates' famous advices is do not harm, meaning the first thing to do is do not harm the patient, and this advice is known to all doctors in the world. What is meant is that the first and most important thing required of the doctor is not to cause harm to the patient. In other words, avoiding harm is more important than providing benefit. Therefore, the doctor should not be generous in prescribing medications, and the patient should not be lenient in taking these medications. Today, follow along with us to learn some of the secrets of nerve damage or nerve pain caused by taking certain medications and what these medications are. Therefore, doctors must remember and patients must know that damage to peripheral nerves can occur due to the use of medications, and this is known in neurology, as many scientific studies have shown. It has been agreed between scientists and researchers to give this problem a term, that is, a specific name. Drug-induced peripheral neuropathy means damage to the nerves of the peripheral nervous system caused by a chemical substance used in medicine to either treat, diagnose, or prevent disease. Since you are listening, you are most likely concerned about your health and are looking for a reliable scientific method to restore your health and enjoy your body and life. As is known, taking medications is among the causes that harm the nerve, and therefore it is very important and necessary for you, whether you are a doctor or a patient, to become familiar with these medications, especially the common medications, as you may be using them and most patients do not know that there are medications that damage their nerves over time. It may be the cause of the pain, and these medications are toxic to the nerves and cause nerve damage. If this happens, the patient initially complains of nerve pain and blurred skin sensation. If the nerve damage increases, the patient may complain of muscle weakness and disturbance in the movement of the legs and hands. In order not to be long, I will mention to you 4 types of common medications that cause nerve damage, as scientific studies have shown, but please be patient and do not stop taking any of these medications before consulting with the treating physician for the sake of your health. The first group is anti-anxiety medications, and a large number of people take these medications. According to statistics from the American National Institute of Mental Health, 20% of adults take anti-anxiety medications, meaning, 1 out of every 5 people takes this medication, and this is a large percentage, and these are used. Medications are usually used for several reasons, including relieving anxiety and tension, and sometimes helping with sleep, but these medications have a harmful effect on the nerve. These medications, or a group of these medications, include many medications, including diazepam, bromazepam, alprazolam, lorazepam, and others. The second group of these medications are antidepressants. During the past 40 years, the use of these medications has increased by 400%, and now in America, according to statistics from the National Institute of Mental Health, 1 in 4 people takes an antidepressant medication. Examples of this group are fluoxetine, escitalopram, sertraline, and duloxetine. As for the third group of these medications, they are the medications called calcium channel blockers, which are a group of medications to treat high blood pressure. These medications include amlodipine, diltiazem, nifedipine, and others. So the first group of medications that may cause nerve damage and increase nerve pain are anti-anxiety medications, the second group are antidepressant medications, and the third group are blockers. As for the fourth group, they are statin medications, which are cholesterol-lowering medications. These medications are taken by more than 200 million people worldwide despite their negative and harmful effects. In 2012, the U.S. Food and Drug Administration, FDA, issued an important warning called a black box warning due to the danger of these medications. Here are some common names for these medications so you can get to know them: atorvastatin, rosuvastatin, simvastatin, pitavastatin, and others. Let it be known to you that I am mentioning here the scientific name, that is, the active ingredient in the drug, because the trade names differ from one country to another. This is a study published in the Journal of Foot and Ankle Research on peripheral neuropathy due to taking statins. This study shows an increase in the probability of neuropathy occurring as 4 to 14 times higher in people who take statins compared to those who do not take them. This is another study published in the Scientific Journal of Diabetes Research, which showed that diabetics who use the cholesterol-lowering statin drug are 7 times more likely to suffer nerve damage than those who do not take this drug, even if they have diabetes. Now you might say, I am taking these medications and I have pain, so what should I do? The answer is in one word: do not stop or discontinue any medication on your own. See the doctor and discuss this issue with him and ask him to cancel the medication for you. If he does not agree, then you can visit another doctor. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to our channel for more health tips and information on how to take control of your well-being. If you have any questions or experiences to share, leave a comment below, we'd love to hear from you. Stay informed, stay healthy, and take care of your nerves. See you in the next video.